Hello, everyone, and good morning, good afternoon, good evening. I know we have people joining really from all across the globe today. It's very exciting and quite a large group that we have joining the discussion and very lively already in the chat with all of the introductions. So thanks so much for that, and do keep introducing yourselves if you haven't had a chance yet, and of course, keep the discussion rolling in the chat as well during the session. My name is N. Herod Lang. I'm the Executive Director of PHAP, that's short for the International Association of Professionals in Humanitarian Assistance and Protection. And it is my pleasure to welcome everyone to today's webinar entitled Inclusion of Persons with Disabilities in the COVID-19 Response, Applying the IASC Guidelines. This is organized jointly by ICFA, PHAP, the IASC, and the Reference Group on Inclusion of Persons with Disabilities in Humanitarian Action. It's also a pleasure to introduce my co-host, Mirella. Mirella, over to you.
Yes, thank you, Ann-Harad, and greetings to all colleagues. I'm also looking forward to this event, and as you mentioned, Ann-Harad, my name is Mirella Shuterici, and I am the Director of Policy at ICFA. Welcome to all.
Great to be on the line again with you, Mirella. So before we get started with the substance of today's event, I will briefly go over just a few technical points regarding the webinar platform so that we can all get the most out of our experience today. First, if you encounter any technical problems at all with the platform, please do try using one of our backup video or audio-only live streaming options. These use less bandwidth, so they can make it easier to connect if you have some difficulties with your internet connection. However, they do not allow for the same degree of interactivity with the exercises, the chat, and polls. However, they are a good backup. So to connect to those, if you need, simply follow the links that you see now on your screen. And if you need those links later in the session, just mention it briefly in the chat, and my colleague Jane will be happy to share those links with you again in the chat as needed. At the bottom of your screen now, you will find a box with closed captions. We're also providing automatic machine translation of those captions in real time into Arabic, French, and Spanish, so you can view the captions in any of those languages simply by using the drop-down selector in the middle of the caption box. If you find that you have trouble or problems with the Captions pod, or if you're following the live stream backup option that I just mentioned, you can still access the captions using your browser at the link on the bottom of the slide that you see now. And again, my colleague will be happy to post that in the chat as needed. Simply mention in the chat and she'll do that right away. There is also international sign language interpretation in today's event. You'll find that in the upper right-hand corner. The sign language interpretation has been kindly supported by the German Federal Foreign Office through Handicap International. Thank you very much for that. It's really appreciated, especially for today's event. If you have any questions for the speakers at any time during the session, please submit them using the Ask a Question box in the lower right corner of your screen. And note that if you would like to ask your question anonymously, you should make a note of this when submitting it. Otherwise, we will use your first name when we pose your question to the speakers. You can also post questions to Twitter using the hashtag #InclusiveResponse. So with that, we will turn to introduce the substance of our event today. Now, while the COVID-19 pandemic is seriously affecting the health, livelihoods, and overall well-being of people all over the world, persons with disabilities are disproportionately impacted, and the risk factors and consequences of COVID-19 on people with disabilities are even further exacerbated in humanitarian contexts. In today's event, we will be looking at some of the ways in which humanitarian actors can ensure that persons with disabilities are included in the response to COVID-19 in humanitarian contexts. This was the topic of a recent publication, the IASC Key Messages on Applying IASC Guidelines on Disability in the COVID-19 Response. And we will take these key messages as the starting point for an opportunity to draw on learning from the past 6 months and present concrete actions that humanitarian actors can take in partnership with local organizations of persons with disabilities. We have a very exciting set of presenters today who will be sharing brief examples from different response contexts in Latin America, in Africa, in the Middle East, and in Asia. But we would also very much invite all of you on the line to share in the chat any experiences that you have had yourselves, and we'll compile these and share with everyone after the event. For those of you following the live stream, please do use the chat function in there, and my colleagues will be reposting your examples here in the main event room so everyone can see. We would like to open this session with some personal reflections from Dalal Al-Taji. Dalal works in Gaza as the head of the Continuing Education Department of the Palestine Red Crescent Society and has agreed to share with us her experience with COVID-19 as a woman with disability living in a humanitarian setting.
Okay.
Dalal, yes. What has been your experience during the pandemic? Over to you.
Well, first of all, I would like to introduce my name is Dalal Al-Taji. I work in the Palestine Red Crescent Society as the head of Continuing Education Department. I think of course, I have a visual disability, totally blind. So being under a health crisis like COVID-19 for anybody is not easy. But for a person with disability, I think it's very, especially as for a visual, of course, you have to go out. If you need to go out, you have to touch things. And this is a very great challenge. But the main challenge that I am facing, and I feel it's very important, is the access to information. Here in the Gaza Strip, we have every day there's a map that comes from the Ministry of Health on numbers of people who are, affected by COVID at the moment. So this is a challenge in how can I access this information, because the map comes not as accessible. So I have to depend on somebody else to read for me what number or what are the statistics, or so that I can be aware of how to manage. Of course, the second challenge is the living in Gaza. We have the healthcare here is not as strong as and everywhere it's difficult, but here, because we are under siege, the healthcare is not easy. Also, the challenge is the internet. I'm talking to you now, and the internet cut, and then it comes back. The electricity at the moment is cut, so I'm talking with the battery. So this is another challenge. When you work as a lecturer, I work as a lecturer also, and I have learning, like distant learning electronically. So you have to face the challenge of students either not being able to have internet, not being able to have electricity at the same time. So these are the main challenges that I really feel as a person in general and as a person with disability. Also, I have a personal assistant who usually takes me out to do things. At the moment, she can't reach here because I live in a different place, and everywhere is blocked due to the spread of the COVID at the moment. So this is another challenge, and I have to how I can manage to go out if I am in need. So I think these are the main challenges that I have felt as a person with disability.
Great. Thank you, Dalal. And just to stay with you now for another minute, as you know, we're going to be focusing in this session on practical actions for how humanitarian organizations can help address some of these challenges, and you've laid them out very well from a personal perspective there. And we will later in today's session be hearing from another presenter in Gaza looking at an education project there. But Dalal, as I know that you'll have to leave us soon for another webinar, could I ask you now already, is there anything positive in this regard that you yourself would highlight from the response in Gaza? Back to you.
Yes, there is positive. I mean, we have, although we have these challenges, we have also we provide services for persons with disability as working in the Palestinian Christian Society. So, what we're doing at the moment is, for example, we have a WhatsApp group, and these WhatsApp groups are for parents of children with disability, and they get advisory videos on how to deal with their kids during the home quarantine, what activities their kids could do. Also, these groups are interactive, so children send videos of what activities they do. Also, we give videos or audio concerning how to wear, how to use the mask, the hygiene, how to keep yourself safe. All is that, everything is done both audio, visual, and with sign language translation for persons with hearing disabilities. So we have overcome this challenge, of internet. Parents who don't have internet or who don't have WhatsApp, there's always communication with them through the telephone to check what are their needs, what things they have. Also, we have this is like the guiding services of the technical services. We have also services for children who are with disability and who are living under poverty. So we have the World Food Program of Action. The World Food Program, is giving at the moment to parents of children with disability in the PRCS Gaza Strip here, coupons, so that the families who are unable at the moment to go out and work can actually buy things for their kids monthly. So these are the two main positive things that we are trying to work on.
Thank you so much, Dalal. Yes, it's been great to have you.
And it's been great to be with you.
Yes, thank you so much, and all the best for your next engagement, and thank you for being with us, Dalal. So now we're going to turn over to Mirella for the next segment. Mirella, you have the floor.
Thank you, Angarat. Angarat, we have with us today also Kirsten Long, Program Specialist on Disability Inclusive Humanitarian Action at UNICEF. And Kirsten is also a co-chair of a reference group on inclusion of persons with disabilities in humanitarian action. Welcome, Kirsten. Kirsten, you heard Dalal's story about how she experiences this period, and of course lots of challenges, but also lots of solidarity and courage. And I think the work that the reference group has done also with the key messages document is very much welcome. So it would be great to hear a bit more from you about the process around this document and what does it cover in general.
Great, thank you, Mirella, and also a big thanks to Dalal for sharing your experience with us. That was really important and a good way for us to start off this important discussion. So the reference group on inclusion of persons with disabilities was established earlier this year as a follow-on from the IASC task team, which developed the guidelines on inclusion of persons with disabilities in humanitarian action. The group is co-chaired by the International Disability Alliance, CBM, and UNICEF, and it was really established to continue that coordination between organisations of persons with disabilities, UN agencies, NGOs and other humanitarian actors, which we saw as being very positive during the process of developing the IASC guidelines. Very early on in the group's establishment, we also set up a working group specifically on the COVID-19 response within the reference group. And this working group really recognised the specific challenges to a disability-inclusive response to COVID in humanitarian settings, and recognised that particularly at that early stage, the existing guidance on a disability-inclusive COVID response was not always directly applicable in humanitarian settings because of those specific challenges that we face in those settings. So, for example, some of the guidance around preventative measures, such as hand washing, was more challenging in humanitarian settings where there's really a reliance on communal wash facilities, for example. So what we did as a reference group, and specifically the working group on COVID, was we collaborated with IASC Results Group 2 on accountability and inclusion to develop this note, which is really intended to complement the IASC guidelines. We aim to be very brief with concrete messages on how the guidelines can be applied in the response to COVID-19. The note basically outlines the factors that contribute to risk for persons with disabilities, including barriers to accessing prevention and response. Also outlining very briefly how gender and age factors also intersect with disability to increase risk for persons with disabilities. And then the note also sets out some concrete actions to address both the health and the socioeconomic impacts of COVID-19. So that's the note in a very summarised form, but I do encourage everybody to have a look at it for themselves.
Yeah, thank you very much for this presentation of a note. And you mentioned that some of its messages focusing specific on addressing the health impacts of COVID-19. What are these key messages?
Right. Thanks, Marilla. I mean, very briefly, the note sets out actions that can be taken to address barriers to accessing preventative measures, such as I mentioned earlier, WASH. So what kind of actions can be taken to ensure that people with disabilities can also exercise those preventative measures that we're recommending for broader populations? It also really emphasises the importance of accessible information, which was also something that Dalal highlighted just now as being really essential for people with disabilities to be able to keep themselves safe. And we'll also be hearing a lot more about that today during our discussion. The note also sets out an overriding consideration for both the health and socioeconomic impacts, which is advocating for partnership with organisations of persons with disabilities. This is really fundamental to improving the inclusiveness of our response to COVID-19, and we'll be hearing a lot more about that also today during the presentation. And the second overarching consideration that's included in the note is disaggregation of data by disability, which is again really essential to understanding both how COVID-19 is impacting on persons with disabilities, but also how they're being reached in the response.
Thank you, Kirsten. And you mentioned the socioeconomic impact, which of course is also very substantial. What messages do you give to address this socioeconomic impact?
So in relation to the socioeconomic impacts, the note addresses some complex issues around the increased risk of violence, exploitation and abuse, including gender-based violence, which we've seen has been very much a risk during this pandemic for many people, but particularly for persons with disabilities. It also sets out the need to ensure that children and youth with disabilities can be supported to continue learning in the context of school closures, which we're already seeing are resulting in children with disabilities being even further left behind in terms of access to education. And again, particularly so in humanitarian settings where they were already facing compounding barriers to access. It also sets out the importance of inclusive mental health and psychosocial support, particularly again in the current context, which we're seeing as even further exacerbating the isolation of persons with disabilities where the response is not fully inclusive. So this is just a really brief summary, but I think you'll find that as we listen to the presentations today, many of the key messages are very much reflected in the positive examples we're already seeing being implemented in the field. So thank you, Mirella. Back to you.
Right. I'll just jump in here. Thank you, Mirella, and thank you, Kirsten. And now to follow on Kirsten's pre-shadowing of the presentations, I'd now like to help further set the stage. We'd like to invite all of you in the virtual room today to participate in a brief exercise to help us reflect all together on what are the key elements to making the response in humanitarian settings inclusive. So you should be seeing now a large chat box on your screen. Please share a few brief words. Please use 10 words maximum, if you wouldn't mind, listing one or more elements that you find really critical for making response to COVID-19 in humanitarian settings more inclusive. And if you're in the live stream, you can also just type in the chat, and my colleagues will copy-paste from the chat. So you can participate as well if you're in the live stream. We'll give that a few minutes for responses to keep coming in. And if you have multiple ideas in your mind, feel free to submit multiple entries. Yes, and I'll be asking Kirsten to reflect in real time here on what we see. I think now we're starting to get critical mass of input. This is very exciting, actually. Fun to watch. So, Kirsten, whenever you feel that you have that critical mass, feel free to jump in with some comments.
Sure. Thanks a lot. It's really great to see all these ideas coming out, and what I'm particularly liking is how big participation is. So that is definitely going to be very much the theme of this webinar, where we'll be hearing a lot of examples of where humanitarian actors have partnered with organisations of persons with disabilities, very much in line with this principle of nothing about us without us. Partnership with organisations of persons with disabilities being really key. Some of the other words that I saw popping up that I thought were great is better. So yes, I think one of the other key messages we'll see coming out today is that inclusive programming, it's not just something that's nice to do, or it's not just something that we do specifically for persons with disabilities. Inclusive programming is really better programming. Inclusive programming is about quality programming. I also saw at one point innovation popping up, which I thought was really interesting, and I think the current context, COVID-19, we're very much forced to innovate. We're forced to do things differently. We're forced to adapt our programming, and I think that provides us with a really important opportunity to strengthen inclusive programming more broadly, to really learn from our experience of adapting our programming. And lastly, before handing back is, the word has just gone now, and I thought it was a really great word. Oh dear, it's moving too quickly. Which one was it? Intersectionality, I think, is also really absolutely key, that we need to remember that people with disabilities, as anybody else, are whole people. You know, people with disabilities are also going to be women, men, older persons, children, youth. And we need to ensure that when we're looking at inclusive programming, we factor in all of those elements and consider all the factors that place somebody at heightened risk, and also all the factors that we need to consider in addressing barriers to ensure inclusive programming. Plenty more I could say here because there's so many great words coming up, but I will leave it there. Thank you.
Okay, terrific. Thank you very much, Kirsten, and what an interesting exercise. So now moving on to our presentations of practical examples. For our first example, I would like to introduce Henry Swaka, Disability Inclusion Assistant, and his colleague, Agnes Olulese, Protection Officer, both with IOM in South Sudan. Henry, you have an example from South Sudan where you were working together with local OPDs in order to improve the organization's needs assessment. Could you please share with us a bit about this partnership? How did it come about? Oh, if you may need some assistance to unmute yourself, Henry. And in the meantime, let's go over to Agnes. Are you there, Agnes?
Hi.
Hi, Agnes. No problem.
Okay.
So I think, Henry's working on unmuting himself, but in the meantime, it would be great if you could share with us about the partnership.
Yeah. Hello.
Oh.
Can you hear me now?
Yes, we hear you now, Henry, loud and clear. So very good. You have the floor.
All right. Thank you very much. So basically, our partnership with the organizations of persons with disabilities started prior to COVID-19, but particularly about this initiative that we took about COVID-19, it all began with an assessment, an initial assessment which we did in Juba, because basically when COVID-19 broke out and it became a pandemic, we thought people with disabilities must be among those that are badly affected or critically affected by this, and for us to get the information, because we already had contacts with them, so we developed a tool to do the assessment, because basically we wanted to understand issues around access to information, whether the members of the OPDs, like the organizations of people with disabilities, whether they knew about COVID-19 and preventive measures and all that. So we started by running focus group discussions with executive committee members of the organizations that are based in Juba. So Juba is the capital city. And later on, we also interviewed other members who are not in the boards or in the leadership of the organizations, but who are ordinary members. And so that was how the partnership began, the assessments began. And some of the key findings from that assessment were really, I would summarize them into like 3 to 4 categories. There were issues around access to information. There were issues around the economic impact of the crisis on people with disabilities. And there were issues around education, the fact that the lockdown or partial lockdown also interfered with the education of everyone, but also it affected children with disabilities or students with disabilities more seriously. So those were the issues. So in regards to access to information, what people with disabilities told us was that for those with hearing and speech impairments, particularly, it was not easy to get information around COVID-19. That's because the media that are being used, like most messages are shared on radio, maybe on mobile phones, but people with hearing and speech impairments, especially those who are not educated, would not really benefit from information shared on those platforms. So there was a gap in that sense. But also other people with other impairments also, like if you don't have a radio, so they told us that most of the people, especially those who are in rural areas, most wouldn't even have a radio, and so that would mean that they were excluded unless someone else shares information with them. In terms of the economic impact, one of the key issues they shared was that the lockdown actually affected some people directly. So there was one respondent who was telling us he's visually impaired and his wife was the breadwinner in the family, but when the markets were closed in the initial phase, that meant his wife lost her job, and that meant the family was affected, and the man himself was not employed because he, being visually impaired and having not got an education. He didn't have a job. So this was just one person, but we would assume that this probably also affected other people similarly. But also one of the things that happened with this was the fact that because it was partial lockdown in South Sudan, so the transport system was still functioning, but there were some adaptations that were made. So, for example, buses wouldn't carry full capacity, so that means you would have half capacity. But what that means until now in South Sudan is that you pay for 2 seats. So for everyone, if you are using the bus, you pay for the seats you are using and the seat that is left empty. So that has affected everyone. Of course, everyone has complained about it because you are now paying double, but it's worse for someone with a disability, especially if they have to move with a personal assistant. That means you're going to pay for 4 seats because 2 seats that you're occupying, but 2 seats that have to be left empty because of social distancing in the bus. And people with disabilities are obviously among those who are quite excluded from the employment sector. The majority of them are uneducated, as I mentioned, and that means that with this additional crisis, their economic status is made worse. And the challenge about education is that since the closure of schools, children have had to attend classes on radio. That has been one of the steps taken by the government. But when we were talking to the Association of People with Hearing and Speech Impairments, they told us that this actually affected them particularly because when lessons are run on radio, that means they're excluded, and these lessons are not run on television. But also, television is not something that everyone has at home. I mean, the majority of people wouldn't have a TV set. So these were like the major issues that they told us about. And maybe one last thing about the economic side of things also, or something to do with poverty and disability, is that there are families or there are situations where children with disabilities are forced to beg, or they are sent to beg on the streets because that's sometimes the only way in which some people survive on like begging for money. But that means now with COVID-19, and that's also going to that actually exposes them to the risk of contraction, because that means you're getting money from people that you don't know. You are coming into contact with many people because you are asking for money. And so those were really the major issues that they highlighted. In terms of response, one of the things that we have started doing, basically we would like to engage with them and to see, because some of those things have to do with livelihoods. Even before COVID-19, I think we all agree, and there are many studies that have proved that people with disabilities are among the disadvantaged economically. But I think that with this COVID-19, now the situation has been made worse, and that means we need to respond both during this period of COVID-19, but also that means I would say it's a wake-up call for us to make sure that people with disabilities are not left out in any way, and that's the motto of the SDGs, leaving no one behind. And so I would say that one of the things we are doing currently is that we have worked with one association of people with speech and hearing impairments to produce a video with COVID messages in sign language, so that at least we can share this on the national television, but also on social media platforms. Of course, that's not going to be responsive, or that's not going to resolve the problem completely, but we hope that will increase access to information for people with hearing and speech impairments, because the sign language version that is used is not necessarily going to only help people who are educated, but some of these signs are basic, and I think that some people will be able to benefit from that. And we are still looking forward to further engagements, and we'll of course also do advocacy with other organizations working on this COVID-19 response. Maybe I'll end there for now, unless there are questions, or maybe I'll hand it over to Agnes if she has any additional points that I might not have touched on.
Perfect. Henry, Agnes, would you like to come in on any points?
One of the things that perhaps was interesting also is when we were working with the organizations of persons with disabilities, they also seem to be stranded in terms of what can they do, and this is where we also saw that there might be a need to see how we can try to build capacities for them to push and advocate to be engaged a bit more, because at that point they're also flustered and they're feeling like, well, we're not sure we can do anything, and perhaps that's another thing that we need to look at and see how do we build capacities of organizations for persons with disabilities to get also on the front line of some of these conversations. But I think Henry has said the rest well enough. Thank you.
Thank you, Agnes. Thank you, Henry. Again, very much appreciate both of you joining us today. Now, next, we will turn to an example from Latin America. We have with us Gabriel Soto, Director for the Southern Cone region with RIADIS, and his colleague Rosario Galarza, Human Rights Officer with RIADIS. Gabriel will be providing some introductory remarks in Spanish, so if you do not speak Spanish, please keep an eye on the captions so that you can read them there in English. And then we'll, following that, have a presentation from Rosario. So, Gabriel, el micrófono es tuyo.
Sorry, this is Rosario. Gabriel, el micrófono es tuyo. Puedes intervenir. ¿Estás con micrófono prendido? Sorry, I am translating her. Maybe he was not aware of the words.
Hola, ¿me escucha ahora? Hola.
Yes, we can listen. Yes.
Hola, ¿me escuchas?
Yes, sí, te escuchamos, Gabriel.
¿Ahora sí?
Sí.
Ahora sí, perdón, no podía conectar el micrófono.
Ya puedes empezar. Días.
Sí, bueno, empiezo. Buenos días a todos, y en especial a los organizadores de seminarios web, particularmente el grupo de referencia sobre inclusión de personas con discapacidad en acción humanitaria. Mi nombre es Gabriel Soto, miembro de la directiva de la Red Latinoamericana de Organizaciones No Gubernamentales de Personas con Discapacidad y sus familias, RIADIS, y soy punto focal de RIADIS ante ACNUR, con quienes estamos llevando adelante un proyecto de investigación para hacer un diagnóstico de la realidad de las personas con discapacidad en situación de migración, refugio y movilidad humana en sus trayectos desde su origen a los países de acogida en América Latina, en el cual también estamos viendo los efectos de la actual pandemia en esta población migrante. Mi compañera Rosario Galarza les presentará las líneas de trabajo, el cual ha sido una oportunidad muy importante para RIADIS, porque al ser una organización de personas con discapacidad, hemos logrado consensuar con ACNUR para hacer posible este estudio y visibilizar las necesidades de las personas con discapacidad. Gracias a todos y los dejo con la palabra de Rosario.
Well, good morning, everyone. This is Rosario Galarza. I am based in Peru. I am here to support my colleague Gabriel in the presentation of this regional assessment that we are doing in partnership with UNHCR. I think we have the presentation now. Please let me know if you have the presentation.
Yes, we have it.
Okay. First, this is, as I mentioned, this is the regional assessment that we are doing as a partnership between UNHCR and RIADIS. Next one, please. Well, let's talk a little bit about RIADIS. RIADIS is the Latin American network of non-governmental organizations of persons with disabilities and their families. RIADIS was founded on October 17 in 2002 during the first conference held in Caracas, Venezuela. Currently, RIADIS represents 56 organizations of persons with disabilities in 19 countries in Latin America and the Caribbean. And the main objectives of RIADIS are the promotion, defense, and monitoring of the rights of persons with disabilities in Latin America and the Caribbean, based on the principles contained in the UN Convention of the Rights of Persons with Disabilities, the CRPD. And RIADIS is a Latin American member of the International Disability Alliance. Next one, please. Well, now let's talk more about the objectives of this regional assessment project. The first objective is to conduct a regional assessment on the situation of refugees, displaced persons, and migrants with disabilities in Latin American countries of transit and destination as part of the regional response, programming, and design as a first step, in order to have an overview of their situation, and in a second stage, develop or prepare concrete actions to respond to their needs and improve their protection and inclusion. Next slide, please. Well, in case of the second objective is to produce audiovisual materials in accessible formats for persons with disabilities, promoting the dissemination of key messages on COVID-19, prevention and mitigation, including gender-based violence prevention and response, as well as informational videos for humanitarian actors to raise awareness and promote the inclusion of refugees and migrants with disabilities in the humanitarian action in COVID-19 plans. This regional assessment involves 7 countries: Mexico, Nicaragua, Venezuela, Colombia, Ecuador, Peru, and Chile. Next slide, please. Well, now we are going to talk more about what are the actors that are involved in this regional assessment. First, we have obviously UNHCR and RIADIS. This is a very strong partnership between RIADIS and this UN agency. RIADIS is located, as I mentioned, in Ecuador. Then we have the support of another NGOs. For instance, we have SODIS in Peru, which is called Sociedad y Discapacidad. It's like Society and Disability in English. We have also COAMEX in Mexico. And we have Humanity and Inclusion that is working especially in Colombia. Well, next slide, please. Now we are going to talk about what are the target groups that are part of this regional assessment. First, in this research, we have incorporated 3 target groups. One is persons with disabilities and their families, and assistant and or support persons. And why assistant and support persons? Because sometimes persons with disability, when they are migrants or when they are displaced, they are not traveling with the families. Sometimes they are traveling just with the support person or maybe personal assistant. That's why we are going to include the perception of these persons in this regional assessment. Well, we also have the humanitarian actors as other important group in this regional assessment, because we consider that we need to test, we need to know, and we need to test if the services that they are providing are really inclusive, especially for migrants and displaced persons with disabilities. And then as a third actor, we have the governments in order to know if they are taking appropriate measures to include migrants and displaced persons with disabilities. Next slide, please. Now we are going to focus more on the 4 phases that we have in this regional assessment project. The first one is the preparation phase. And in this phase, we have some options. First, the establishment of a technical team. The technical team composed of different consultants from SODIs, Humanitarian Inclusion, QAMEX, and RIADIS. Then we have the other action in this phase is mapping of the stakeholders and contact list of organizations working on human mobility. In this study, this regional assessment, we have to map all the actors that could be involved, stakeholders involved in migration or displacement. As a third action, we have the development of research methodology as well as qualitative and quantitative data collection instruments. I mean, because one of the limitations is that during this situation of COVID-19, we need to do everything online. That's why we don't have like a field on the ground. We don't have like a work on the field on the ground, and that's why all of the interviews, the focus groups are online, just using platforms or maybe accessible platforms, and also including some phone calls, because most of the migrant persons and displaced persons, they especially are targeted just on the phone. Well, we have the second phase is that data collection. In this data collection, we have first that desk review and data collection. We elaborate like a desk review with the information, existing information about migration and displacement in the 7 countries that we are working on. And then we have another action that is to prepare a draft of a desk review and analysis report based on all the information that we have, also CRPD recommendations, maybe a SDG country report, to prepare a desk review report. And then as a third action of this second phase, we have the review and feedback of this draft report by UNHCR. Next slide, please. Now, in this slide, we are going to talk about the other 2 phases, especially we have the phase 3, data analysis and interpretation phase. In this phase, the concrete actions that are analysis of collected qualitative and quantitative data. We have also the preparation of the country report, because as we are working in 7 countries, first we need to prepare like a country report for each country, and then we are going to summarize and to do like a final whole report. And definitely we need some feedback. That's why feedback, especially from UNHCR and also from other stakeholders. And final phase is the presentation of the outcomes. First is the preparation of the draft final report. Based on the individual country reports that we have, we need to prepare like a final draft of the whole report. And then another action is review and feedback of the report by UNHCR. And then finally, the delivery of the release of the final regional assessment report. I would like to emphasize that in this kind of phases, we are incorporating different accessibility issues in order to provide reasonable accommodations, especially for persons who have been interviewed, as for instance, sign language interpretation of kind of things. And also sometimes people who don't have like a mobile data in order to be part of a focus group. We are also trying to provide some mobile data to these persons in order to improve and also to ensure effective participation. Well, next slide, please. Now we are putting here one of the main principles of the 2030 Agenda: leave no one behind. Because we consider that maybe this topic was not explored before for other organizations, and that's why we consider that we were leaving behind maybe persons in context of human mobility, such as displaced persons and migrant persons. But now the reality is having this partnership, a strong partnership with UNHCR, we consider that we can advance in these issues, and also we really expect that we can contribute more to attend this population, to respond effectively to their needs, and to ensure inclusion. And first, the final slide is the Riadis contact. As Gabriel mentioned, he is the coordinator of the project, of this regional assessment project. He's a coordinator, and also we have a project coordination in Riadis, where Mario Poruncajas is project coordinator in Riadis. You can contact both of them in these emails that we have here in this slide. Okay, thank you so much.
Thank you, Rosario, and thank you also, Gabriel. Gracias. Great to have both of you with us, and thank you so much for sharing this very, very interesting and helpful example from your experiences. Next, we'll be returning to Gaza to hear from Sharaf Al-Faqawi regarding an example on education concerning remote learning and return to school. Now, Sharaf's internet connection has been in and out today, so we are going to be playing a recording of his presentation, and then we will hopefully have him still on the line live to be able to answer some follow-up question afterwards. So let's launch the recording now.
Welcome for all. For the presentation, Humanity and Inclusion Good Practices on Remote Learning. During the COVID situation, 2 million people in Gaza Strip continued to live under protracted crisis due to the political and armed conflict. 80% of Gaza people depend on humanitarian aid. Electricity cut reached to 12 hours per day. With the COVID situation, a lockdown implemented. While specific challenges related to education was encountered, teachers of special schools were not included in the Ministry of Education support plan of COVID-19. Schools' budgets for e-learning and parents' use of technology. Due to the general context, a pre-developed cluster emergency plan has been activated during the second week of March 2020. HI was a member of the Distance Learning Task Force. So the objective of HI intervention was to ensure learning continuity for children with disabilities who could not access the Ministry of Education remote learning system. Our target was more than 300 children with disabilities in 3 special schools. In order to implement the distance learning, by the third week of March 2020, HI and partners have selected 20 teachers from special schools who were trained previously on adapted learning strategies. Remote technical support through Skype and social media applications have been provided to them on how to make video lessons with available resources they have, such as their smartphones and uploaded to YouTube. Complementary support has been provided for teachers through providing them with teacher kits that includes education materials and stationaries to use during the development of the videos. On the other hand, more than 300 students supported by stationary materials to be able to follow the remote learning classes. To support the remote learning, individual and collective education support sessions provided for parents of children with disabilities through the use of social media apps and phone calls for those who have no access to internet. Here is a picture snapped from a video for the Arabic as letter. The teacher using materials provided with the teacher kit. The lesson is interpreted with sign language. With this experience, HI and partners of 3 special schools ensure the continuity of learning for around 300 children with disabilities. Teachers' capacities on distance learning enhanced. Parents' capacities to support children at home strengthened and their role in child education increased. Ministry of Education plans to include sign language for the Ministry of Education e-lessons. Also, parents shared a positive feedback about the provision of individual and collective education support and how videos improved their capacities to, as it was the first experience to happen in HI and partner schools, teach other children. Learned the following ways for teachers to collect children learning outcomes from distance learning and to provide timely feedback to children should be designed well. Distribution of offline version of e-classes needs to be planned to help children without internet connection to learn. It was planned but was not implemented due to the movement restrictions. As remote learning is engaging more parents and family members to support their children, parents' literacy skills can affect their children's participation to remote learning. Based on our experience, we are recommending the following. Evaluate the effectiveness of distance learning practices. Make the curriculum and textbooks accessible digitally and compatible with e-learning. Offer complementary support such as stationery for children, teaching materials for teachers, and phone calls for parents. Improve teachers' capacity in e-learning modality and the use of its platforms such as Google Classroom. Include mainstream teachers in training on digital support for children with disabilities. Include parents in the planning of the e-learning. And enhance education emergency preparedness and response plan to be more inclusive with budgets. Lastly, we are glad to announce My Hero is UMH PSS book in accessible format in Arabic, supported with a video showing illustration of each page, an audio narration, Arabic Sign Language, closed caption, and possibly sub-audio track with a narrated description of the illustrations. Thank you.
Okay, great. So thank you so much for sharing that video with us. Do we have you now on the line? Sharaf, do we have a connection to Sharaf?
Hello? Hello? Yes?
Yes, I hear you. Yes, very good. It's a bit quiet, but I can raise that. Very good. So, Sharaf, thanks so much for sharing the recording. We really appreciate that, and it's terrific that you're able to join us now. Hopefully, we won't have a cut just within the next couple of minutes. So, a follow-up question to you then. Following what we've learned now about the experience in Gaza, I'm wondering, are there any ideas at this point or plans on how to support children with disabilities on return to school? Is that in discussion at this stage already, a return to school? Back to you.
Yeah, recently in these days we are living under the complete lockdown. Still, the discussion for the return back to school activities and going back to school is still under discussion with the Ministry of Education and UNRWA. For persons with disabilities, still with the special schools, still they are facing difficulties to have children going back to schools, as they are following the general declaration of the emergency situation now. Still, it was planned that we could start the school year again in September, but now it's postponed. Till now, there is no specific date for this kind of return. All the preparations that are being implemented by the Ministry of Education and UNRWA and other education stakeholders is targeting the e-learning platforms and how to engage children and their parents within this e-learning platforms, including Google Classroom and the Rawafid website that is related to the Ministry of Education.
Great. Thank you so much, Sharaf, and thanks for taking the time to be with us and share with us today. We'll now be moving across the globe to an example from Indonesia on inclusive information and communication. We're joined by Idi Supriyanto, who is the founder and chairman of Sehati Sukoharjo, an OPD in Indonesia that is partnering with ASB Indonesia and the Philippines. He is also a volunteer and training officer with ASB, and in that position, he has been working on inclusive COVID-19 information. He's also joined by his colleague Agnes Pantongloan. Agnes will be answering any questions that you may have in the chat. Thank you so much, Agnes, for that today as well. So turning to you, Idi, could you tell us, please, what problem were you trying to address with this project, and how did you approach it? You have the floor.
Hello everyone, this is Idi Supriyanto speaking from Indonesia. I would like to share about good practices of inclusive information and communication we jointly conducted during the COVID-19 outbreak. So it was all started in collaboration between IASB Indonesia and the Filipina with several local organizations, including organization of persons with disability or OPDs, by conducting joint survey and how information on COVID-19 prevention measure can be communicated inclusively. Persons with disability and other persons were among the respondents. So on the left side, the PowerPoint presentation with the question of the survey. While on the other side, you will see the result of the survey in infographic, which I will only show to without going into detail. So in the survey, I need to find information on one, the device of information required to anticipate COVID-19 and relevant to current situation. Two, preferred media and method of information dissemination, either online or offline. Three, information format, both online and offline. All the factor inhibiting the prevention and preparedness against COVID-19. The five, general and specific impact of the COVID-19 to persons with disability and other at-risk groups. The finding, we used formulate an inclusive information and communication strategy which is implemented in action as follows. Providing media for information dissemination both online and offline, which are accessible for community members in respect to diverse characteristics of needs. We also to ensure that information distributed through social media platforms are accessible and easy to comprehend by adding image, reliable text, and language interpretation or videos. Second, developing a mechanism for face-to-face method to outreach those without access to internet connecting and or digital literacy. Next, providing information contact inclusive of the needs of persons with disability during the COVID-19 outbreak. It is also worth noting that COVID-19 prevention measures such as physical distancing and personal hygiene maintenance remain difficult to carry out by those requiring assistance in their daily activities and those without access to personal hygiene facilities. Accordingly, with the consultation to persons with disability directly, we developed COVID-19 preventive tips for people who need assistance from their caregiver. We also provide supporting facilities such as personal hygiene kits to encourage behavior change of the communities. Further to careful consideration is the specific impact of COVID-19 transmission and emergency response regulation and measures towards the livelihood for persons with disability and that at risk group. This includes ensuring access to healthcare facilities and basic necessities. And last but not least, collaboration with local OPDs as facilitators, initiators, and resource persons have proven to be significant in the effort of making our information and communication as well as response in general more inclusive. Next, conclusion, inclusive information and communication is accessible and actionable information. 2. Informing or providing necessary support for people to alert on the information timely and properly. Okay, that's all from my share. Back to Max. Thank you very much.
Thank you very much, Eddie, and also to Agnes behind the scenes there for your contributions in the preparation. Very much appreciate both of you helping to contribute to the discussion and to bring this great example from Indonesia. We'll now go on to another example on inclusive information and communication, this time from Ghana. We're joined by Christiana Asante Nkansa, who is working as a communication specialist with Plan International in Ghana. Christiana, you have been working on Plan International support to the Ghana Blind Union during COVID-19. Could you please tell us about this work? Over to you.
Hello, can you hear me?
If you could raise your volume. Yes, that sounds good, Christiana. Excellent. Over to you.
Okay, so from the time the first 2 cases of COVID was announced in Ghana, that was on the 12th of March, the government of Ghana decided to take precautionary measures and then alert everyone. We in Plan International realized that with all the safety protocol, education, and all that was going on, there was a minority of people who were left behind, which were the blind and the deaf. So as a team, after our initial assessment, we decided to bring these people on board as well. So we collaborated with the Ghana Blind Union to convert or translate some of the key messages into Braille. And we had a whole booklet in Braille for the safety precautions and other measures that they could use. Since all the government communication machinery didn't include them. For the deaf, we hired a translator and did a video recording of all that was going on and what they could do to prevent getting infected and all that. And we put these videos on pen drives and distributed them to the various schools, these deaf schools, so that they can give them to their students as they were home. One of the other things that we also realized was plan decided to partner with the Ghana Education Service to roll out the TV school. And with the TV school, majority of the students are not hearing impaired. So we decided to bring in the translator for the deaf. And then we also got the school for the blind. Their teachers, we came together with them and decided to do a Braille translation of all that was going on. That was not in their curriculum. Because when school closed, with the online school that was were transmitting through TV and radio, it was different from the curriculum that they were originally using in school. So we decided to translate all that into Braille and then distribute them to the various homes of these children within sponsorship areas. And then the Blind Union as well gave us the go ahead to meet with the various students in small numbers to get their teachers involved in educating them, because we sending the thing to them without any in-person or physical person educating them, sometimes it was going to be very difficult because some of these children were located in very rural areas. So we decided to bring all these people together in smaller numbers and educate them on what to do. And we even use these meeting points as places where we could educate them on sexual reproductive health, because going back to the house to stay home for so long a time, we didn't know what was going to happen to these girls. So we decided to educate them too. So the teachers, the Blind Union was very, very instrumental in this. And also with the deaf and dumb students, it was difficult because these are people we don't interact with on a normal day. So getting videos to them, getting the school teachings to them was quite a challenge. But with their association as well, we got parents who were also deaf who decided to help us to transmit some of these messages we had to the children in their homes, in the various homes. So on the whole, we have on our own as Plan International, we have been able to bring the communication to the doorstep of these excluded people in society by translating the protocols into Braille for them and giving them smaller Braille handbooks which can be kept in their pockets wherever they are to know what they can do. We even got ambassadors from these children to also teach children who we couldn't reach immediately. And it's been wonderful. With the assessments we've done later on, we've realized that information has gone to them more than the government has done for these people in the marginalized groups. So far, that's what we've done in Ghana.
Christiana, thank you so much for sharing this story, and it's a really excellent example, and I must say very energizing to hear how well these efforts are going there. So thank you once again for sharing with us, Christiana. For our final example today, which is also on the topic of inclusive information and communication, I'd like to turn back to Kirsten. Kirsten, I understand that the note on applying the IASC guidelines to COVID response has recently been produced in an easy-to-read version. Could you please tell us briefly about this new version and what the process to produce it looked like? Over to you, Kirsten.
Yes, absolutely. Thanks, Angarad. And it was really great to hear everybody's examples. So thank you so much for everybody who shared the examples of their work. I'll be incredibly brief. So you'll be seeing on your screen at the moment the easy-to-read version of the note. Now, easy-to-read versions, for those who are not familiar, they use very simple language, jargon-free and acronym-free language. They also use shorter sentences with supporting images to make these documents easier to understand, easier to read. It's primarily targeted to persons with intellectual disabilities, but particularly in the context where we work, this is also a really useful format to support people with low literacy, people who may speak a different language, or anybody who may have difficulty at certain points understanding complex concepts. And that could even be for people, for example, who are currently experiencing trauma. It can sometimes be difficult to take in some more complex concepts. Now we also produce the IASC guidelines in this format. It's a very simple process. There are companies that you can engage with that produce this format at relatively low cost. They also consult with people with intellectual disabilities themselves to make sure that the document is accessible. This version that you're seeing here on the screen, it's not yet finalized, but it will be within about 2 weeks, and then it will be available on the same web page where you find the other versions of the note. So that's all I'll say on this, just a very, very quick example of something that you can all do very simply to make information accessible to people with intellectual disabilities and others who may have more difficulty absorbing complex information. Thank you.
That's really terrific, Kirsten. Thank you so much for sharing that with us, and we look forward to the final version being available. And I think we can link to that from the event page, of course, as well, the event page of today's webinar. So we've had several questions come in, and a big thank you to our speakers who have, several of you been actually answering questions in real time in the chat. That's terrific. If you have other questions, please do submit those as well. We may not have time to address them now on the air, but we will be doing our best to follow up in writing to any questions that are outstanding after we wrap up. But now for our final exercise, we would like to focus in on the issue of organizations sometimes finding it hard to know where to get started in making their response inclusive. You should see a poll in front of you on your screen asking, an organization asks you, what can we practically do today to get started? Which one of the following would you prioritize? And please just choose one priority. And as those come in, I hope we get a lot of people responding to that. And as those responses come in, Mirella, if I could turn to you and ask, what were your main takeaways from the discussion today? Mirella, you have the floor.
Yeah, thank you very much, Angara. And it's a bit difficult to answer this question because I found this discussion extremely interesting, and I would like to thank all the speakers for being with us today and sharing their experiences and also what they have been able to put together in these challenging times. Some takeaways. First, great participation. I mentioned that I really appreciate the experiences shared by the speakers, but I also see that we have a large participation and very diverse. We have colleagues from different regions, different countries. This shows the engagement of everyone in addressing the special needs and ensuring inclusivity of people with disabilities in COVID-19 response. Challenges are there, of course. But I think the good practices showed that it is possible to find solutions, and I got some keywords what helps to ensure such solutions and quality solutions, I would say. So what I got is participation of persons with disability themselves, understanding, collaboration, accessibility, and then what I really appreciated was that the discussion was not focusing only on the health impact, but looking also very broadly, and this is also the content of a key messages document of the IASC. It looks at health in a broader sense, including also sexual reproductive health, mental health, and so forth, but also looking at access to information, education, very important, access to labor market and livelihood. So all these issues that impact on the daily life of us all, and of course of people with disabilities. Over to you, Anger. I don't know if we can already see a bit the results of the exercise.
Yes, absolutely, Mirella. So Marcus has just put up the results there, so you can take a look. You should see it in the middle of the screen there. Very good. Yeah. So back to you, Mirella, if you have any real-time comments on what we see coming in there.
Well, I'm not surprised at all. On the contrary, I'm very pleased to see the results, because no doubt, I mean, for me, the starting point is to consult with the persons with disability to understand how they are impacted, what are the challenges they are facing, and also to discuss with them the solutions. And this came very strongly from all the examples that we heard throughout the webinar. And also, I mean, the other elements are also very important, but they build on this element. And then this is really the starting point. If we make this right, if we have a good consultation, I think with the expertise that we have among us and with partnerships, we can find solutions. Thank you, Angela.
Thank you, Mirella, and thanks to all of you responding to the poll. And thanks. I see we've got a couple more questions coming in, which we will absolutely follow up with afterwards. Some good questions there regarding food security and livelihood support to persons with disabilities. Too much to address now, but I think a great one for follow up indeed. So thank you for that, Naima. Now, we have just a couple of minutes left. I'll turn back to you, Kirsten, if you'd like to share with us any concluding reflections that you have that you can leave us with today. Back to you, Kirsten.
Well said. So I just have two main closing reflections. The first one is that COVID-19 has presented all of us with new challenges, but it's even further highlighted the need for deliberate efforts to ensure that people with disabilities are included. More than ever, we've seen that inclusive programming isn't just a nice to do, it's really a standard that needs to be a core part of all of our work. And the second reflection, that we heard a few examples today, a few really great examples, but there are many others of a disability inclusive response to COVID-19 in humanitarian settings. And I think this provides us with a really important opportunity to learn from our experience during COVID-19, where we've needed to adapt our programming to a new reality. And it provides us with the opportunity to really apply that learning on adaptation and innovation to our humanitarian response more broadly. And just to finish up from my side, I wanted to say a huge thank you to PHAP and ICFA for working with the reference group on inclusion of persons with disabilities in this webinar. Huge thank you also to the IASC Secretariat for your support, and of course to all of the presenters and everyone for your active participation. I've just put in the chat and we'll put it in again. For anybody interested in joining the reference group, please do. I'll provide a link to the webpage. Thank you.
Thank you, Kirsten. It's really been a pleasure from our side as well to work with you and with all of the other colleagues involved in the preparation for this discussion today. It's been a terrific experience, so thank you so much as well, Kirsten. Now, everyone, to wrap up, I'd like to mention, if you've not already downloaded it, of course, the Key Messages publication can be downloaded by clicking on the link you should see in front of you now. And my colleagues are also joining it, are also sharing it as a link in the chat as well, so you can download the Key Messages publication. There will be a recording of today's event, both in video and in an audio-only podcast format, that will be available on the event page in the coming days. So with that, I'd like to thank everyone once again, all of our panelists from across the world, all of our participants as well for their very interesting contributions to the discussion. It's been a really active one, particularly with the exercises. So thanks so much for helping out with that. And I'll sign off now. This is Ann-Herod Lang in Geneva. All the best to you all, and look forward to welcoming you again online in the near future. Take care. Bye-bye.